My name is Tyra. I am a nurse and also the coordinator for Medical Volunteers International. I'm 31 and I am a mix. I'm half Swedish, half Polish, but I grew up in Sweden. I first came here last year for 3 months, volunteering with a different NGO, but also as a nurse. And after that, it was hard to not come back, if that makes sense. The reason I came here in the first place was probably just to, there was so much media coverage in 2015-16 about the crisis here on Lesvos, and I just wanted to kind of help out and see what it was actually like, and it was far worse than I could ever imagine. Medical Volunteers International is a non-governmental organization based in Hamburg, Germany. We have 3 different projects, all in Greece, one in Athens, Thessaloniki, and here on Lesvos as well. We provide medical care for people, mostly the refugee community, but also people who struggle in general in Athens and Thessaloniki. So here on Lesvos, we usually used to run a clinic outside of the camp in this community center called One Happy Family. But ever since the lockdown on the 19th of March and since the whole corona epidemic and such, we've moved closer to camp and now support inside camp and just outside with COVID screening, primary health care and emergency care within the lockdown. So MVI has a team of around 10 medics, so doctors and nurses. Also some doctors, students sometimes, like run the pharmacy and such. We also have a team of interpreters. It varies depending on their, because they have to go because of asylum procedures and such, but usually there are around 5-6 interpreters as well on our team from the community. With fundings from private donors and also Mission Lifeline has supported Medical Volunteers International a lot, we're able to continue our work here, providing healthcare for these people in Moria, crucial healthcare and support for the Moria community. At this moment, we focus on COVID screening to screen patients for corona. We've been very lucky so far because we've had no cases of corona inside Moria. However, we are actively constantly looking for it, let's say, in order to detect the first case very fast, in order to act quickly. So that's something our focus is on now, as well as continuing with primary health care provision. Corona would spread very fast in this setting because there's severe overcrowding, also the lack of sanitary facilities, lack of access to soap and clean water. We see it with most upper respiratory infections and such. If they come in these waves and a lot of people get them at the same time because it's so easily transmitted in this setting. So corona is no different, like it's even worse. So we do see that it will spread very, very fast. It's science. A lot of the complaints we see in the clinic are directly linked to the health hazardous circumstances these people live in as well. The lack of sanitation, the wound infection, gastroenteritis, all of that. So you take these people in and you treat their symptoms just to put them back in the environment that caused the condition, if that makes sense. So it is a very frustrating thing not to be able to, there's no form or very little preventative work. It's just very hard to provide that, and that can be very frustrating as a medic working in this kind of setting. I would say most cases we see in the clinic are directly linked to the living conditions. When it comes to infections and scabies and such, there is a lot of stuff as well that are linked to the past, the history of the people. These people are running away from wars and violence and all of these things, and obviously that this stress that this causes on a person, and then coming here and not having a safe environment around you, obviously is an additional trigger to past traumas. which we do see that Moria itself kind of triggers these past traumas. The first priority here in Moria, like out of a healthcare point of view, is to evacuate the camp. This is no safe place out of a healthcare point of view for people to live in. These are health hazardous circumstances, right? Other than that, if it has to continue, then we should work more on improving the sanitary conditions, improving the housing. Yeah, but the most important thing is that this should not be a place. It's not a safe place for people to live in.